Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today, our current 5-day test positivity rate is 1.1%, and 17 new cases of COVID-19 have been identified as of 9:30 a.m. of today. This brings the total number of lab-confirmed positive and probable positive cases to 491. We have 9 current hospitalizations, including 3 individuals in intensive care, 132 active cases, and 351 individuals have been listed as recovered. Number of deaths due to COVID-19 remains at 8. Preliminary lab data indicates 1,452 tests performed yesterday, bringing our total to 96,999. I can confirm that we have 8 cases of COVID-19 that are connected to a business in Brandon. All cases appear to have contracted the virus outside of the workplace, and their close contacts are identified in the community, not in the workplace. So to be clear, there is no evidence of workplace transmission at this time. The cases are currently self-isolating. Contact tracing is well underway. The company has gone beyond public health recommendations and is having a larger number of workers / contacts self-isolate at this time. There is a deep clean of the facility since the cases were last at work. All cases would have worn PPE during the infectious period while at work. As well, workers have been cohorted to reduce the risk. So public health officials, workplace safety and health, agriculture and resource development, as well as the Canadian Food and Inspection Agency are closely monitoring this situation. We're in regular communication with the company and has been quite cooperative and continues to share information with us. A joint site inspection of the workplace was conducted on August 6th, and no orders were issued by Public Health, Workplace Safety and Health, or Canadian CFIA. Any public health recommendations will be made on available information and future inspections and from public health investigations. We can confirm that a case related to a Tim Hortons on 18th Street in Brandon has tested positive COVID-19, worked during the infectious period but not while symptomatic. So this is a very low risk of transmission, but we're making this publicly known. Anyone considered to have been in that location should self-monitor for symptoms for 14 days and seek testing if symptoms develop. As we're seeing the number of cases increase, and we mentioned a cluster in the Brandon area, we're seeing some evidence of community transmission in Western Manitoba, most notably Brandon. And so this is what we expect when we start seeing increasing numbers. So again, I'm advising people, especially in Western Manitoba, to ensure you're following public health advice to reduce your risk. And we're all aware Manitobans are quite concerned, especially as we continue our reopening and we're seeing increased numbers. But we know that we're expecting to live with this virus, so we're going to continue to see cases. And we've been here before, and we know what to do to limit our risks. We're going to focus on those fundamentals. We're going to wash our hands frequently, practice physical distancing when at all possible. That physical distancing ensures that 2 meters or 6 feet from others when you're outside your home. If you're not able to physically distance from others, then wearing a mask is advisable. And again, when we start seeing community transmission, especially in Western Manitoba, when we see in the Brandon area, mask use should be thought of more frequently at this time. And again, what's vital is stay home if you're ill. We can't have people going out and about, going to public events or to work or to school when ill. That's vital to our success. All those precautions helped Manitoba flatten the curve early on, and it will help us, again, limit these number of cases as we move forward. It's challenging times. We've all been living through it. But we're going to be dealing with this virus for quite some time, so we need to ensure we're following these public health recommendations so we can continue to keep our economy moving, but at the same time limiting the effect of this virus on our population. I know Manitobans have appetite for more information regarding COVID-19, and we're going to continue to try to provide as much information as we can to ensure Manitobans are up to date. Please visit our COVID update dashboard, which provides much additional information. Dashboard's been online since the start of the pandemic. You can find it at manitoba.ca/COVID. It has detailed information about total cases, new cases, recovered, and much can be broken down by regional health authority. Those that are higher risk of severe outcomes related to COVID-19 need to take extra caution. Physical distancing is important, hand hygiene is important, wearing a mask when physical distancing can't be achieved, and taking that extra caution if you're at increased risk of severe outcomes. Those include people over age 65, those with underlying medical conditions, those with immune compromise. Again, it's an important message to encourage Manitobans to be kind to each other. We are all going through this together. It's been quite challenging times. There's no place for judgment or shame towards those who have contracted or recovered from the virus. Stigma has played a big role throughout this pandemic, and not just in Manitoba. So stigma can adversely affect our public health investigations. It can make people and businesses less likely to cooperate with public health. It can make people discouraged from getting tested. People may not want to be self-isolating or make businesses less likely to support their staff as they are required to. This cooperation is vital to the success of public health in managing this outbreak. So we're relying on people to get tested, and people who test positive, we rely on them to be very forthcoming, providing us with as much details as possible. And we decrease the likelihood of that if we stigmatize those people. So please help us fight this pandemic with knowledge, with understanding, and our actions, but not with stigma. So again, you can find credible information at our website, manitoba.ca/COVID-19. And thanks again to everyone, and I can take some questions.
Of these 17 new cases, can you describe the transmission link?
Yeah, so it's early. I don't have all the details on these. There's 10 in the Prairie Mountain Health region. Some of those are linked to that cluster, but we know that right now listed on our 7-day non-epi-link cases, those that we can't link. Right now we have 14 cases listed there. That's usually an overestimate because it's just early on in the investigation.
Do you have a number then, because you had that cluster at 28 cases, can we now put, what's that updated number? Yeah,
so again, the investigations are ongoing. Right now we have 34 that we think we're linking right to that. We have about 6 in the Brandon region that we don't think we can link to, so those are what we would determine as community-based transmission.
There was an issue with a lot of people getting turned away from the testing site in Brandon yesterday. Do you know how many tests were completed in Brandon, and if there's going to be improvements made to allow for more testing in Brandon? Yeah, I don't have the numbers on what's the testing numbers from Brandon, but yes, you know, in all regions we're looking to be able to ramp up quickly for the demand, so we are working on that.
Given that the number of positive COVID-19 cases has doubled in the Maple Leaf Foods Brandon plant, speaking to the union president representing some workers says he's still asking you if you would step in and shut down the plant. Since sitting in front of us yesterday, have you revised that thinking, or what's your current thinking on that? Yeah, not at this time. I haven't changed the opinion, and it's the opinion of a number of the agencies in there. So again, it's 8 cases that happen to work there. They're not 8 cases that acquired it there. They're not a single case acquired it there from our investigation.
You said that you would be concerned if there was, you know, evidence of transmission within that workplace. Is there a threshold of what would require you to perhaps close down?
Yeah, and so, you know, each of these investigations, they're individual. They have many moving parts, so we don't, you know, we don't have on the outset that it would be 2 or 3 or something like this. But it's just when we don't see any evidence of interfacility transmission right now, this is what's reassuring us that the measures that are in place are effective. If we see interfacility transmission, then that's going to be a change in our review, and we'll have to address that.
Talking with the UFCW president there, he was concerned that there are several bottlenecks in the facility and issues with the locker room, close contact or close quarters there, issues with the cafeteria. Have they been asked to change anything there? Have there been additional measures that have been?
So based on that, on our initial inspections there with workplace safety and health, public health, CFIA, there wasn't any identified issues that required us any orders. So we're in daily contact multiple times a day, and so we'll continue to look at those things.
With so many more tests now, with COVID-19 testing ramping up, and there being clusters, and there being concerns about spread in the community, how do you prioritize, or is there any way of making a priority list for who gets tested first, or where to go, in terms of the priority list for testing?
Yeah, and so, I think that it's, as we see increasing cases, then we'll see increasing contacts. So the overall priority has to be with symptomatic people or people who are named as contacts to confirm cases. Once we see transmission ongoing, the role of asymptomatic testing significantly drops. So we're really encouraging people to be tested if they have symptoms or if they've been advised to be tested. That's got to be the priority now.
Is there any chance we could see masks become mandatory in certain hotspot areas rather than the province as a whole?
Well, nothing's been off the table. I think that when we mandate things, we want to ensure that we have, the evidence to support it, and that other measures haven't been effective. So we really want to use the least restrictive means as possible. And so we started to really start messaging about masks and the importance of masks. As we see more and more cases, as we get into respiratory virus season, that message is going to be stronger and stronger. We only move to restrictive means using public health orders if other ways aren't effective.
Could it be a case where Brandon, for example, could be mandatory and just there?
Yeah, nothing is off the tables. If we felt that was in the best interest of public health, we certainly would. Certain locations, certain geographic locations, it certainly is possible.
A lot of people are looking at the Alberta cargo plant and sort of what took place there as maybe a parallel to what's happening in the Maple Leaf plant. Is the big difference there that there isn't in-plant transmission? Is that the mark that you're looking at? So
that's the big issue right now as we look at it, and as much as Manitoba's pandemic response is timing. Right, so we've been able to learn from all of those areas that's happened because of our timing, and many of the measures that they had to institute then we've had instituted for months now, and so that's why we're likely not seeing this interfacility transmission.
So just so I'm clear, when you talked about the testing and the priorities for testing, so wouldn't be a case where you, the chief public health officer, might say, Brandon is a hotspot, we got to get on it quick, and so we can do the contact tracing quick. Put them first, Dinah here. Do these tests first.
Yeah, that's the testing turnaround from the lab is still that 24 to 48 hour range, and so it's really difficult to the way that the sampling is received at the lab and pooled there and run to have many prioritized samples. So the best way is just that we have a fairly quick turnaround overall, and that's probably the best we could do.
The 8 cases at Maple Leaf, do we know exactly where that originated from? Was that a gathering outside the workplace?
Don't have a lot of, we know that some of them were linking to that cluster, but all of them are linked to acquisition outside of the workplace.
Okay. Just to go back to that cluster, you noted it's 34, we could have around 6 sort of in that non-UPI linked area. Are we saying that there's 40 cases then within Brandon in the last month, or are there?
Yeah, I don't have the specific number in front of me, but that's the sort of the rough from the end of July. That's kind of the numbers that we're seeing. And again, the non-epi-linked, often they're just, we just haven't found a link yet. But that's the concern, as even with clusters, even when we start linking the majority of the cases, we're still seeing the majority of the cases being linked. The risk increases that that's going to be turning into some community transmission.
Is this the biggest cluster we have had in this province?
This is likely the biggest one we have now. Remember, this one is sort of more in a community area. It's a larger geographic area like this. It's not a cluster around a workplace or anything like that. So, but yeah, it would be a large cluster for us.
EpiLink keeps getting used, that phrase used. Could you just explain to?
Yeah. So that's when we talk about community-based transmission, we're describing non-epi-linked cases. So when we talk about non-epi-linked cases, it's cases that we can't link to someone who just traveled, acquired it through travel, or acquired it through contact with a known case. And so it's important to distinguish that, because when we see known contacts being identified, they've been self-isolating. So their contact list is going to be very small. When we have community-based transmission, these are people who haven't really been isolating at all. So their contact list could be quite large.
When we look at the cluster geographically in Brandon, we have these 8 cases, at one plant. Are there other businesses or other places in Brandon where people should be aware of, where they should be concerned or be getting themselves checked out for?
No, we've the Tim Hortons that I announced was one that we have that. But as we do these contact investigations, that's exactly the thing we look at. Where do you work? Do you attend any other public places? And then if we can't link specific contacts to that, then we'll make a public announcement.
Thank you, Doctor. We're going to take a few calls from the phone now. From the Brandon Sun, Colin.
Hi, Dr. Roussin. Colin from the Brandon Sun here. I know that recently the policy's been to just release numbers over the weekend and then provide a more full accounting of what happened on a Monday. But given the severity of the current situation, will the province be giving any more detail than normal in its weekend updates over tomorrow and Sunday?
Yeah, and so this is part of our response, listening to Manitobans that they want to hear and receive more information. So the weekend bulletins are going to be more fulsome even this weekend. It does take a while to ramp up a lot of this work over the weekend. So, but there will be more information shared this weekend than the past weekend.
Okay. Secondly, I was wondering if the public should be concerned at all about the case of COVID-19 in a worker at the Walmart in Brandon that the company announced yesterday.
Yeah, and so our investigation indicated that individual was not at work during the infectious period, so that's why we didn't announce it. So I mean, I think that. Businesses being aware, taking part of things like this is great. But so public health will make announcements based on our investigation, and our investigation is that there was no risk to the public there.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin. I was wondering if you could just tell us if you know that the cluster in Brandon, is it related to any sort of large gathering? Was there a party of some sort or an activity that brought people together that somehow was at the origin of this cluster?
Yeah, I don't know if we could find the exact origin like that. I think there was a lot of contacts, a lot of contacts identified. A lot of contact tracing went on with a number of people being required to self-isolate, but I don't really have any details of regarding those type of events.
I know you've been asked this question before in these pressers, but I'm just wondering if you could comment on the wearing of masks in schools. We're seeing some school division in Manitoba already deciding that some students will wear them. What's your position on masks in schools?
Yeah, and so like a lot of things during this pandemic, things change, and we need to adapt to changing recommendations. And we know that the Public Health Agency can release some updated guidance on schools. So we've been reviewing that. And mask guidance is in there, and we know a number of other jurisdictions have provided resources on that. So I don't have anything specific to comment on that, but we are reviewing mask use right now.
From CTV Winnipeg, John.
Dr. Roussin, I'm wondering, I know you have told us that the virus isn't spreading within the workplace at Maple Leaf in Brandon. I'm just wondering, can you give us some more details about how 8 workers from the same workplace could have contracted the virus outside the facility? I'm wondering, do they all live together or gather together?
Well, a lot of that's going to be, personal information. What we see is that there's a fairly large outbreak in that area right now in the community. And so that's, and the amount of workers that are in that area. So given all those, it's not that big of a leap to see that these people acquired it outside of work, and we do connect them to transmission events outside of the work. So so that's what we're moving on right now.
We understand that there may have been an exposure at the NICU at St. Boniface, and that some of the parents and children may have been exposed over a period. Can you give us some more details about that?
Yeah, so any type of things like this, we would public health would investigate. There really isn't anything there that we need to warn the public about with it. So we've investigate any potential exposures. We contact anybody who should be deemed a contact, advise them to self-isolate. If we're not sure that we can find all those contacts, then we'll do a public disclosure.
But it hasn't, as far as you know.
Yeah, I don't have details to share on a specific scenario like that.
From CJ Radio Swan River, Trillion. From CJ Swan, Trillion. From GX94 Yorkton, Ryan.
Hi, my question is just regarding the testing site in Russell, Manitoba. I was just wondering, A, will the temporary label be taken off of Russell since we're experiencing a high number of cases in Manitoba, and will the hours be extended as well as increasing capacity for testing?
Yeah, so good question. I don't have an answer to that specifically. What I can say is that every region right now is looking at ways to ensure they're going to meet the capacity of testing moving forward, but I don't have details about the Russell site, sorry.
Okay, and my other follow-up question, I guess this might have been asked several times before, but I guess what would it take to seriously consider making masks mandatory?
Mm-hmm. Yeah, and so I think that that definitely mask use is becoming more and more part of our repertoire here in Manitoba. We're certainly recommending it right now when people are unable to physically distance. Again, the key with mask use is to know their benefit. So their benefit isn't as much to the wearer, but the person around that, the person who's choosing to wear the mask. And it's not a substitute in any way for our fundamentals. So hand washing, physical distancing, those are paramount. Wearing a mask is in addition to those. And so when we mandate things, we need to base it on, our epidemiology, base it on evidence, and base it on the other type of things we've already tried and may have failed. Widespread recommendations and support with education to people about mask use would certainly precede the need to mandate it if that was ever required.
Thank you, Doctor. We now return to the News Conference Theatre and reporters on the floor. Please proceed.
Dr. Roussin, following up on that question about masks, should parents be getting their kids used to wearing masks before going to school in the potential that masks do become mandatory in schools?
Yeah, so we're going to provide more information on that in the near future to parents, and so we'll provide more details on that upcoming.
Okay, we've had a lot of cases recently, obviously, but how's our PPE stocks doing, or share, or not stocks or shares, but our how are we doing in terms of the amount of PPE we still have? Are we starting to run low? Are we in a good position still for PPE?
Yeah, I think for the most part, our PPE has been we've been able to increase our stores on that. I think that in all jurisdictions, there's the spotlight is always on the N95s right now, but we have no immediate issues that we're facing.
It's probably looking at fines for people who may have brought the disease into the community who did not follow proper guidelines.
Well, we have the ability under the public health orders to do that. We could issue orders under the Public Health Act to do that as well. So some of the things that I mentioned there is that when we talk about exposure, possible transmission events, and we list places in the community, we only know that because people cooperate with us. And so when we start fining people and focusing on that, people are going to be less forthcoming. So it is a balance, right? We need to ensure that everyone's taking the interests of all health Manitobans at heart, but we have to balance that with ensuring public health can get the information it needs.
What about this individual that came from the east and didn't follow the protocols perfectly?
Yeah, and so that's one such example there that would be not the details of that the case don't support any any fines or anything like this, and as we investigate that cluster. More, it's difficult to link necessarily the genesis even to that to a single individual either, but it just raises the importance of the need to self-isolate and the need to self-isolate properly.
Cases in Southern Health have been high. There are only 2 today. Is the situation under control now in southeastern Manitoba?
Yeah, it's tough to make that sort of judgment after a day like this. But remember, that's what the whole basis of the public health investigation is. If once we start finding close contacts, those people are self-isolating, so then they should have very few contacts. So we can see many cases develop after exposure, but we shouldn't see continued number of contacts. So that's the whole purpose of identifying cases quickly, isolating them quickly, and doing that contact investigation.
In Brandon, just give us an idea of how big the spread of this cluster is. Do you know how many households this is impacting in Brandon, as opposed to just the plant, but how many households are being infected by this?
Yeah, I don't have that number. It's certainly wider spread. It's not just in a couple households, and so you can tell that by a number of the just the sheer numbers that we have, and now that we're seeing some spillover into probably community transmission in that area.
And for the workers that are infected there, were they all on the same shift, or were they working different shifts or different parts of the plant?
Yeah, I don't I don't have all the details on those type of specifics on it, but we do have clear acquisition events that took place outside of the workplace.
Has Maple Leaf implemented perhaps any additional screening measures? Could there be, say, a testing site at the plant?
So when we started working with workplace safety and health and public health have been working with these industries, from the beginning because of what we saw in other jurisdictions. But when we started identifying these cases, we found that the measures that were in place were above and beyond what public health was already recommending. So there really isn't a whole bunch more that they could do at this point. So they've gone above and beyond with their contact investigation than what we had determined, and so there isn't a whole bunch more to put in place.
But they haven't put anything additional within the last week?
Yeah, I don't. I don't know necessarily the timing, but I know what's being done right now is there just really couldn't be much more that we could recommend.
When you talked about the one case from Eastern Canada, and you said it wasn't, it's one example, but it wasn't the sort of example you would use to, enforce the regulations and fine someone. Is there ever a case? When would you consider that? When would you want to make an example of someone?
I think somebody that showed a reckless disregard to our orders and to Manitobans, that would be something that Manitobans would expect us to enforce. When people are, it's challenging times. When you're self-isolating at home, it's challenging to do so and not come in contact with anyone. So again, I think that the overall message is that everyone needs to do their part, and it's been a while since we used that type of terminology about doing your role, right? That was a time when we were telling everyone to stay home for the most part. Now we've found ways, or we hope to find ways, that we can live with this virus. We don't have to shut things down. We don't have to tell people to stay home, but they still have to do their part. We've heard of, say, restaurants where we get reports of overcrowding there, and there's calls to enforce the public health orders, but that also goes for the patrons there. Right? If this is not a time that you should be in a crowded venue. And so it's really up to all Manitobans to continue to follow public health advice, and we've done it before, we've been here before, and we can stop this transmission again.
There are 5 cases in Winnipeg. Do you have a sense on community or travel?
No, I don't have the details yet on those.
The number of active cases are rising, and we're around 30 away from where I think our peak was. Mm-hmm. How concerning is that to you?
Well, I think that, again, we're not following necessarily just case counts, where we follow our positive test proportion, which still remains relatively low. We are looking at things on the demand on our healthcare system, which again is relatively low. And then we look at, community-based transmission. So again, we have a number of active cases, but still, relatively speaking, very few are ones that we can't link to known cases or to travel.
What goes into the decision to come in on an off day? Like, where's the line there? What's the threshold?
I don't think there's a specific line. I think that there's a lot of decisions that get made, and so it's we had a lot of calls for more information from Manitobans, especially over the weekend, and then when we saw this uptick in cases, we thought it would be appropriate to ensure we're out there meeting that demand.
Any more? Or just maybe just on the active cases. You said we are looking at other measures, but are you concerned by that active case number?
Yeah, certainly we're seeing increase in case numbers, concerns us. And that's why we're, getting out ahead of it with the messaging. Public health is very active doing these contact investigations to try to limit that spread. And then again, getting that message out to Manitobans that, we're seeing some community-based transmission. And so, but we know what to do, right? We're not helpless against this virus. If we wash our hands frequently, if we stay home when we're ill, if we practice that physical distancing, we're going to dramatically decrease our risk of acquiring this virus.
Last one.
Thanks, everyone.